Thank you very much. Thank you very much, everybody, for joining. I just wanted to do a bit of introduction of both myself and Aaron. We are both co-founders of the company, and we've been working together on this solution for more than 10 years, different research that we've done together. However, we are trying to make this deploy this easy to use solution to be able to support every stakeholders within the HIV sector, especially with the focus on the patient. And behind us, we've got many people who are supporting us. And on top of this internal group, we also have scientific advisors that are actually globally representative. Without wasting much time, I just want to delve into the presentation, but setting the ground with this slide. I'm sure this is data that most of you know even better than I do. But two things that I wanted to say with this slide is that even if we have a vaccine today, these people currently living with HIV will not be candidates for vaccine. And also, this population is growing older because HIV is no more a death sentence, and they are growing older with the disease. However, that comes with the challenge of other comorbidities that are associated with growing old, which then gives a bit of challenges to clinicians on how to manage this population, especially with all these attending comorbidities. And that's why, our product, not only looking at how to empower the patient, but also how to support clinicians and all the other stakeholders. Here is a result of a needs assessment on whether there's a need for the solution in this space. You can see that everybody that we surveyed actually feels like there's a need for digital solution within the space, and 93% actually says that they will use the solution if it were to be available, and over 3/4 says they will recommend it to a friend or a colleague. And at that point in time, it was actually a concept, and for this gives us the necessary motivation to start the development. Everywhere in Africa, this is the kind of challenges that we face. On the left-hand side, you have patients waiting at a clinic just to collect their ARVs, and in the middle, you have people who are waiting for routine checks to collect their medical lab results as well as collect ARVs. And if you look at this population, they're actually not terribly sick. And some of this information, some of these activities can actually be pushed back to the community, collecting or having medical laboratories in the community, community pharmacy to pick up refill. And the burden on these patients is enormous because, as you can see, these are not rich people. So they are taking time off, to go to hospital, losing their means of income for that day, and also spending money, to be able to afford transportation to those clinics. And how do we solve, some of these issues? Because these are some of the issues that actually, making it difficult to retain clients in care. These are one of the issues that actually make them to fall off treatment, to fall off monitoring. And how do we leverage digital solutions to be able to support some of these, empower some of these patients? We also have issues around prevention uptake, and we know that prevention uptake as well as treatment, kind of the way you roll out these programs kind of also impact on stigma and discrimination. As these people are waiting in the hospital, people who know them might be passing by, they see them in an HIV clinic, and this can portend stigma and discrimination. So, this is this is really very highly stigmatizing to patients. And we see by deploying digital solution, we could actually, shield patients from stigma and discrimination. And our solution actually does that. It also supports the uptake of prevention, whereby even in the event of taking up prevention methods, you can do this in the secrecy of your room, disclose the result of those tests, and then get linked to treatment centers nearby without having to go to a hospital or being seen around an HIV facility. Please, if there are questions, you can post this on the on the chat, and I will pause and respond. And if you can also unmute yourself, I'm happy to stop so that we can answer your question. And we have the app, and the app actually empowers patients in terms of uptake of prevention. For instance, we have the at-risk feature. The at-risk feature, this is where people at risk can use the app to locate and get linked to treatment centers where they can go in for testing, or where they can actually order home testing kits, and they can do their testing kits, do their testing in the comfort of their home, in the secrecy of their home, and then report the results of that test to the nearby treatment centers, and they can be linked through the app to treatment. And because they are submitting some data with that report, the clinician can then decide whether to prescribe treatment to them, which they can then pick up in a nearby pharmacy, in a nearby community pharmacy. And the whole process is done without actually exposing the client to stigma and discrimination. And the app also has the I'm a patient, I'm a clinician, and a body profile. The idea is that the patient connects with their clinician, and also a social support system, trusted friend, trusted family member, peer support group, whereby these people can support them in the journey so far. And it's really an easy to use app. It has all the different features that support and empower patients, and we will see this in due course when Erin demonstrates the app. It has the medication reminder, whereby you can set when the pills need to be taken, and you will get an alert during that time, and the medication can be taken. It also has a feature whereby we know that in most parts of Africa, you can buy any medication of the cancer. And with the medication features, you can check whether those medications will interact with the ARV, and whether they are highly likely to interact with the ARV before taking them, even including food products. We have the adherence monitoring bit, whereby self-reported adherence is monitored over time, and suggestions of things that are holding the client back. And this information is also available to the clinician when the connection is established. We also monitor suppression and provide advice on how to and the kind of adherence to maintain, to be able to enjoy the best outcome from the ARV. We have the risk calculator, whereby we provide some kind of risk of having a cardiovascular event or metabolic syndrome event. Beyond connecting to the clinician, when things are not going well, the patient can alert their clinician, and certain information will be sent to the clinician, so that the clinician can intervene in real time, and whether to bring the patient to the hospital or not. We monitor a lot of health parameters. Where clients can also set appointment reminder, whereby 24 hours before the appointment, they are reminded, so that appointments are not missed. And this appointment reminder is also available to the support system. For instance, a trusted friend, they will also see the reminder, and they can also support the patient, so that we can reduce missed appointments. We have daily motivational quotes. This is just something that we implemented such that every day at 9 a.m. something positive for the patient to start the day. And this is actually one of the features that we never expected to have a big impact, but we've got huge feedback on how this is supporting, uplifting people on a day-to-day basis. We also know that there is a lot of myth and conspiracy theory about HIV. Your information needs is where we present all credible information from credible sources to patients based on the category of information that patients are interested to receive. And looking at this digital solution, we are confident that this would help with supporting prevention, locating new infected people, and also locating clients, even if they move around or if they migrate. As long as they have the app, they can be located, and we can link them to treatment centers. We can make sure that we monitor that they are treated and they are retained in treatment, and also monitor the day-to-day activities, health parameters. And we understand that this will go a long way to actually do something for patients in reducing stigma and discrimination, because we know that every program that has been rolled out, billions and billions of dollars have been spent in sensitizing and educating the population, but still, stigma and discrimination is still a huge issue because nothing has been done to empower patients and to shield them as much as possible if they don't want to have their status disclosed, because it's a journey to reach the place whereby people can be open about their status. I don't know, I can pause a bit if there are any questions.
There is a question actually from Emmanuel, Shola.
Okay.
I don't fully understand, but it says, what are the other 4 of the 5 you mentioned only at risk? What of the others? I don't fully understand. Emmanuel, you can unmute yourself and ask if that's okay.
You mean I'm a patient, I'm a clinician, I'm a body. I mentioned the at risk, which is one of the profiles of the app, and this is the one that supports prevention uptake. I'm a patient. This is where a patient registers and download the app, registers, and then they can invite their clinicians, to connect so that they can make their information available to their clinician, which means the clinician can support them in real time without having to go to hospital. And the body is you have a trusted friend, or you belong to a support group, and they have people that support people living with HIV, and you can connect with them and they can support you in the journey, because they can connect with you in real time, because you may not be living together, you may be in totally different locations, but they can connect with you and support clients in real time. I hope I understood the question correctly. Otherwise, you can unmute and just clarify the question.
Okay, we can carry on, I suppose. Emmanuel, is everything okay? No, Shola, let's carry on.
Okay. So, and so what apart from the app, we also have other solutions for the other stakeholders. We know that there's a lot of complexity in how to managing patients, especially with attending comorbidity. We've provided a web-based dashboard where we support clinicians to make optimal decision in terms of ART selection. And in fact, in countries like in Africa, where there are no medical doctors readily available, this can also support other workers, nurses, other allied health professionals to be able to offer help to patients, when it's needed. We have the Smart HIV Manager. This is where, for planning purposes, we've developed a tool that can help the service managers or policy makers to identify needs for planning purpose, and also what are the resources needed, what are the human resources needed, what are the resources needed to be able to achieve UNAIDS targets. All those kind of information, can be generated from the Smart HIV Manager based on service specific needs. We have the Smart HIV trial list, because within the app, we ask if patients will be interested in participating in clinical trials. And this is where we link them to clinical trials that are happening globally. And apart from offering them participation in clinical trials, this is also an opportunity for patients to have access to innovative medicine. We know that in some countries, the availability or the options available in terms of ARVs is limited. This is where patients can then have opportunity to have free access to innovative medicine. We also know that some patients are off therapy because they need to pay certain fees and they cannot afford it. But by enrolling in clinical trials, they have access to free treatment. We have the HIV auditolytics for program managers. This is where people, the clients that are using the app, we present summary level data about the patient population, and they can detect whether issues are happening to a pool of clients in certain locations, and they can then make sure that they intervene. And some of the information can be around mental health, it could be around adherence issues, it could be around suppression issues, and this is made available to the program managers, and they can intervene in real time. The app has a lot of features, and it's available for download, and you can have it free for I think for 2 weeks to explore some of the features. It has comorbidity management, brain teasers, whereby we encourage patients to learn about their disease so that they can wage educative war against the disease. So that is it in a nutshell. And we also know that for all these systems, this can be integrated with any organization's existing system. We know that every organization has one system or the other, so we can integrate this. They can be used as a standalone or be integrated to the existing system. And this solution, we can actually, I can quickly show you the way they look on the web. This is how they look on the web. For the Smart HIV clinician, this is the one that the other healthcare professionals can use, and based on patient information, they get set of results, on how to best manage the patient. For the Smart HIV Manager, this is like putting a health service in a simulation environment, and it attaches resources that are used by each of these patients as they enter the service and leave the service. And based on this modeling, we can then look at service demand requirements, human resources requirements to meet UNAIDS targets, what are the requirements for prevention programs, and also budgeting. This is something that is used to support service managers and policy makers. This is the Smart HIV trial list, where we link patients who are interested in clinical trials to clinical trials that are running, and they will be put in contact with the researchers. This is how the same web form for the auditolytics. This is where you look at all the patients that are currently using the app, summary level information. You cannot identify any particular patient. However, what is possible is that you might be able to see, which country they are, but you cannot identify a particular patient. So, and that is the beauty. It just gives a summary level information. It might be able to tell you which state they are, but not not to the level of the patient details. So, and that's the audiolytics. So that is about it. I'm going to go back to my slide, and we can see that based on all these different solutions that we deployed, this can be used by any stakeholder within the to support them in decision making, to empower patients, and we believe that this is actually the way to go. And we've run a lot of pilot studies, and we can also see that, especially on the app, we can see that every level of people can use it, from no education, primary education, to master level, from young age to old age. So it is an app that is made to be very easy to use for any age group, for any educational status, and we've got really good satisfaction, based on the current users. And also, we've also done a lot of study around how does it impact of cost savings for a service. So, and this is all good results to say that by deploying the app, because you are reducing the number of visits of patients make to hospital, you are also reducing waiting time. You are going to be able to reduce the workload of doctors and also the nurses. And at the end of the day, you are going to reduce a lot of costs for the healthcare system. And that's the end of the presentation. Thank you.
Thank you very much for that, Shola. Do we have any questions or any suggestions, remarks before we go to the next stage of the webinar, which is the demonstration? Maureen, Emmanuel, anything you want to ask? Yes, it is available in Nigeria. You can download. You can, in fact, a lot of the pilot studies and that Shola just mentioned are taking place in Nigeria. So it's readily available. Okay. I mean, you can continue, typing your questions if there is any. So what we want to do is that the next stage is really some sort of a demonstration of the app. And what I want to do is demonstrate how the app supports patients' day-to-day management of the disease, but also how it enables them to, how it kind of empowers patients to take control. So what I'm going to do is I'm going to share my screen, my mobile screen. Okay, can you all see my mobile screen now? You should have 3 profiles. So this is the app, which is available on Play Store and App Store, and you can download at your own time. Okay, so what we have, as Shola mentioned earlier on, we've got 3 profiles here. I'm a patient, I'm a clinician, I'm a buddy. So there's a bit of a two-way connection between a patient and a clinician, a patient and a buddy. In this case, the buddy being, it could be a peer support group, for instance, within a community service. It could be a friend, a family, a trusted member, so that where they can provide support, because there's lots of evidence in the literature clearly evidencing how peer support kind of supports people living with HIV in terms of their disease, managing their disease, the psychosocial aspect of it, and so on. So it all starts with, I'm a patient. So this is where you can create an account using your mobile phone number or an email. And let's assume I've created an account using my email address. So I'm just signing in. And I'm just going to put my password. Okay, and here I am in my app. So once you've created your account, either using your mobile phone number or email address, you land onto this main dashboard. Now, the main dashboard, we can only populate all of the features once we've managed to complete my survey. So my survey, there's about 15 categories of questions that we ask, and the data is collected so that we can then start utilizing some of those core features, such as risk calculation, your reports, and so on. And it's mandatory to complete all of the questions for the first time, but all subsequent My Survey completions, you can deselect certain categories. For instance, demographics information do not change all the time. Your vaccination information will not change all the time. So you can deselect these, and for my subsequent survey completions, these categories will be removed from the sections. And you can handpick what categories you want to complete. Now, this could be completed every week, once a month, once a quarter, or you can decide on the completion with your healthcare professional just before your appointment, for instance. So it's important that the survey is completed on a regular basis, and you'll see exactly the reasons why. So let's assume you've completed My Survey, and then all of that information will be used by all the algorithms within the BeSmart Chart app. I see a question from Emmanuel here. It says, how do you monitor the data collection? If the question's around monitoring the security and data confidentiality, we have the data stored within something called AWS, Amazon Web Services. It's by far the most secure cloud server that's available in the market, which is used by the US Defense, UK Defense, a lot of the governments around the world. So we take data security very, very seriously, and there's all sorts of encryptions added on top of the current security provided by AWS. So that's where the data is stored. We have no access to personal data, only the patient themselves have. Okay, so I don't know whether if that answers your question around the data collection, but we can get into the details maybe towards the end. Right, so once we've, let's have a look at some of these core features. We can set your medication reminders over here, so that 15 minutes before you take your medication, a reminder is given in the form of notification. But one of the core features within the medication reminders is something called the drug-drug interaction. So imagine if I'm taking this HIV medication called Sustiva, and I could also be on non-HIV medications because I may have some other comorbidities. And so, for instance, in Africa, in fact, most parts of the world, there are medications that we can pick up over the counter. And how do we know that over-the-counter medications, whether if they interact with your HIV medication, and again, which is part of the self-management aspect of features. So let's, for instance, I'm someone who takes illicit drugs, cannabis, and that interacts with my HIV medication called Sustiva. So there is some additional level of information provided over here, so that before I take my cannabis, I need to be informed that it highly likely interacts with Sustiva. Something simple as garlic, for instance, is a grocery product, and we consume this on a regular basis, but it also interacts with my HIV medication. I could be on a diabetic medication called metformin, but it does not interact with my HIV medication. So I'm now being provided additional level of information before I take non-HIV medications. So this is the part about self-managing your disease, particularly around comorbidities. We know there's people living with HIV, they have elevated risk of comorbidities. They could be on co-medications, and this is where we kind of provide that additional level of support. Adherence, medication adherence is still a big challenge. We hear this time and time again, from practitioners, from the literature, and so on. So we try to keep track and monitor a patient's adherence to medication based on the self-reported adherence scores. It's 52 out of 120. In fact, it's not good. There's a bit of a fault here. I'm not adhering to my medication. We'll have a look at the reasons why I'm not adhering, particularly the causes of non-adherence. So that's information that's shared with your clinician. There's also information around suppression. So the medication that I'm on, Sestevia, my overall expected suppression is around 79%. But for me to hit that 79%, I should be adhering 92% of the time. I'm well below that. So something needs to be done around medication adherence, and we'll have a look at the reasons why. Shola mentioned something about the risk calculator. There's as I said, HIV is associated with other comorbidities. So here, what we have is cardiovascular risk. So there is an algorithm behind, based on the information provided. My risk of cardiovascular disease is about 3.61%. That ranges between 1 to 4%. I should be aiming for less than 1%, in fact. And the health advice is, well, I need to exercise 30 minutes per day. I need a healthy diet. I'm a smoker. I should stop smoking. But again, something that needs to be discussed with a healthcare professional. There's also other risk calculations, things like metabolic syndrome risk, diabetes, for instance. In this particular case, based on the information that I've provided, I'm not at a risk, but the causes of metabolic syndrome risk is provided at the bottom. And there's other risk calculations that we're currently working on, things like risk of hospitalization and so on. Again, these are all part of self-management and making sure that the patient is able to monitor their disease over time. There's two ways that you patients could establish connection with their healthcare professional. One of them is via a web-based portal. Let's see how that works. If I want to alert my clinician because I'm depressed, I'm not adhering to my medication, I could have my suicidal ideation, whatever serious concern is, I could enter the email address or the phone number of my healthcare professional. So just for demonstration purposes, I'm just going to show this with my email. So this is the email of my clinician. And here I'm alerting them. So it's successful. What happens now? An email is sent to my clinician. There you go, it's at the top. And that's the alert. And here's the email that is sent to my clinician. And there's a bit of a text here that they can read. And somewhere in the middle, they can view my report. So let's see why. Let's see what my clinician sees. So we've got some patient information at the top. So the name, surname, the age. This is where they can identify the patient. Something about their diagnosis, their HIV regimen, all the non-HIV regimen the patient is on, any concurrent medical conditions that they're on. Aha, that's the problem here. I am not adhering to my medication. It needs an intervention. And let's see what other issues. Can you see this longitudinal graph? This is the first time the patient has completed my survey, and all the others are subsequent. So, in terms of physical symptoms, this patient isn't doing badly. The night sweat is under control. Sleep disturbances, that seems to be doing okay. The patient is having only a little disturbance. Weight loss, well, there is some weight loss going on, particularly during last year, December and January this year. But there's other issues here. My general health is fair, in fact, and it's been deteriorating. My health compared to 1 year ago is poor. There's something wrong with me. And my happiness about life, I'm not happy. I think I'm depressed. I have some there are some mental health issues going on here. Physically, I'm doing fine. My viral load, I'm suppressed. My CD4 count is greater or equal to 400 cells. I'm doing fine. But there is something wrong, with my mental health, and I may need some support, some counseling. And so these are some of the symptoms that the clinician could see by simply alerting your clinician. And there's plenty of other features. And There's health and well-being through the app. So you can see, you know, all the smiley faces, all those physical symptoms are doing fine. But the latest information that I've provided in terms of my mental health, psychosocial, emotional aspect, I'm not doing well at all. And something needs to be done. There's also the appointment reminders. So 24 hours before your next appointment, this could be a blood test, your follow-up appointment, there'll be a notification that comes up over here. This daily motivational quotes. So every day at 9 a.m., there is an inspiration of the day that's sent through the app, which seems to be working quite nicely, actually. We have had a lot of positive comments and feedback, particularly it kind of inspires the person with using these quotes of the day. There's your information needs. Shola mentioned that there's a lot of myths and unreliable information around HIV on the internet. This is where we kind of bring together all credible sources together. So there's information about the latest developments, the latest clinical trials, information around, you know, contraception methods, disclosure, jobs, education. There's huge categories. So this is where they have access to blogs, latest blogs, newsletters, easy to read articles, all in one. So all they have to do is click on the article that they want to read. And here we are, some easy to read information available as and when it becomes available. So that's the kind of the main dashboard. There's plenty of features that we have. We've got brain teasers, for instance. I mean, we believe education is the way forward. So there's some quizzes, interactive quizzes and exercises. Are female condoms reusable? So there's we've got a bank of questions that comes up a couple of days a week. Well, no, and you submit. So it's all part of educating and empowering the patient. And there's reports section. So there's detailed reports that we provide. So let's say I want to go back the last 6 months or 9 months, for instance, and I want to have a look at my condition. It's important that we provide information over time longitudinally. My adherence, it was very poor last year autumn. I've had some improvements over time, but I'm still not where I should be. I'm not adherent to my medication. But what are the causes? What's holding me back? Adhering to treatment plan due to side effects, integrating treatment into daily routine. These are all the problems that I'm facing. Maybe the time has come for me to switch to a new medication to minimize the side effects. So again, a discussion needs to be had with the healthcare professional. But exactly, you know, these are the reasons, these are the causes that should be discussed so that they can find a solution. My cognitive problems over time, you know, I seem to be doing okay-ish physically, and so, you know, I'm having issues around, you know, difficulty paying attention, difficulty planning activities. I'm having issues around memory loss. Physical symptoms, I'm doing okay. I seem to be having some headaches occasionally, not so much dizziness. You know, physical symptoms wise, I'm doing fine. So there's quite a bit of a, I do have some nausea, vomiting. Could be because of the side effects of the medication. That could be the reason why I'm not adhering to my medication. So there's quite a bit of a reporting here. Quality of life. So this is where your current general health, you know, it's pretty bad. You know, mentally, I am rock bottom. I do need an immediate intervention. This is where patients could receive their medical laboratory results. Shola mentioned earlier on, you know, why are these patients traveling very long distances, waiting in long queues just to pick up their medical laboratory results? Why can't it be sent via the app? So that saves money, that saves long queues, that saves doctors and nurses time, and so on. So there's lots of reporting here. You know, we can invite a buddy for connection. We can disclose a status, you know, my HIV status via the app, and so on. So there's lots of features here. I just want to very quickly show how patients could connect with their clinician. So let's say I want to establish a real-time connection and share my reports. Let's say I'm a patient in Mozambique. Maybe I should have given Could have given an example in Nigeria, but I've got Mozambique saved here. And I'm I live in state Nampula. And there we are. That's the city that I received my treatment, and that's my hospital. And here's my clinician in the database. If I can just tap on this clinician, press on connect, then what I'm doing as a patient is I'm trying to establish a connection with my healthcare professional. So if I press connect, let's say I've sent this request. I'm coming out of the patient section and going into my clinician. So so the clinician has created an account. So I am now the clinician logging in. So here I am, the clinician. That's all of my connection requests made by my patient. So this is the patient that's just made the connection request. I can add the patient or reject. And assuming I've added the patient, this is where they land. I have all of my patients here. I might have a couple of hundred patients that I can search. And this is the patient. This is what we mean by saying real-time connection. It's important that these data set is shared with the clinician, because you can see the patient is depressed. We've seen it. The patient has suicidal tendencies. Their adherence is well below 50. So there's some critical information at the top that needs to be tackled immediately. So as a clinician, I can go back and see how this patient is doing over time. Look, this patient has been doing, poorly. So as a clinician, I can see all of the causes, all of those holds back. I can see all of those information that I've just gone through in the reporting section. Look at this depression. I mean, look, this patient is depressed all the time, loss of interest in life. They have suicidal tendencies. They're not satisfied with the regimen. I mean, they're satisfied with me as a clinician, but they're not satisfied in the care system. So there's lots of reporting that's provided. And so that's just a bit of a quick demonstration of the app. I'm sure you can now start visualizing how this connection with the clinician, connection with the peer support group could support patients and empower them so that there is that constant monitoring going on. This is how we can make sure that the patient engages in treatment. This is how we can minimize retention in care. This is how we could reduce stigma and discrimination, because everything's happening around the app, at the secrecy of your own home. You don't have to visit the clinic all the time, for instance. Anyway, so that's a quick demonstration of the app, and we've got about 6 or 7 minutes actually for you to ask questions. You can unmute yourself. Please fire as many questions, suggestions, and comments that you might have. And there's myself and Shola is here to answer your questions. Anything, Maureen, Emmanuel? We've got a new arrival actually with us. I mean, is it all kind of making sense? You can unmute and ask.
It makes a lot of sense. I've followed quite well, and I would say that the presentation is quite explanatory. So I do not have questions from my side.
Thank you very much for that, Maureen, and thank you. Emmanuel, you asked the question about data collection. I mean, have we managed to answer your concerns around, I'm assuming it's around data security and data confidentiality? I mean, the general questions is, the first question that we always have is around, data confidentiality and data security. But another question that we have quite often is usability. And I think Shola just mentioned, had a slide about, based on the pilot studies and the workshops we've had in Nigeria. In fact, we've worked very closely with the network of people living with network of people living with HIV in Nigeria. And most often, I think in excess of 80% of the time, we had a very high satisfaction we've had no issues around, people being able to answer the questions within my survey sections, even including those people with no formal education. They didn't really experience much of an issue completing the survey using the app. Obviously, just with any other tool, you can only learn something as you kind of spend some time playing around with the tool, and that's the kind of the easiest way. Any other questions? We've got another few more minutes. Does anyone want to kind of provide any feedback around the innovation? I know Emmanuel said it's quite good and appreciate the innovation, so thank you for that, Emmanuel. We've got a new arrival. Hi, Borbala. Sorry, have I managed to pronounce your name correctly?
Yes, actually, it's pronounced Borbala. I'm so sorry that I came late. I had clashing events, and that's why I'm quite late.
Oh, not to worry, Borbala. We're kind of recording. We've recorded everything. So what I'm going to do is to share this recording, and you can watch it at your own time. Okay.
Okay, thank you so much. That will be perfect.
You're welcome. Thank you. I mean, we're working very closely with a fair number of organizations in Nigeria. So sometime in October, this is going to be deployed with one of the implementing partners, hopefully with the 140,000 people living with HIV. So there is going to be a mass deployment fairly soon. And we've also deployed this within a number of organizations. So one of them is a PEPFAR funded organization in Nigeria, and a number of other HIV services. So we have lots of evidence around the usefulness of the app. We've got lots of information around the perception and satisfaction of using the app from patients themselves. So particularly around how it supports the daily management of the disease. Just the last 1 minute, and then we're going to close the session.
Okay,
Shola,
so
is there anything you want to add just before we close?
No, nothing from me. I think Maureen wants to say something.
Oh, Maureen, yes, please.
Okay, yeah. So I know that before now, I wasn't aware of this app. I just want to know if there's been any publicity on the app, because I see that it's it's a perfect innovation for a lot of people living with HIV, and it will be so helpful for them. But I don't think a lot of people are aware that an app like this exists and just how helpful it can be for them. So I want to know if there's like any publicity for it, if there are campaigns, if there are just what the whole logistics around making it known to everyone is.
Yeah, thank you very much, Maureen. As you know, the whole issue around stigma and discrimination for HIV patients, it's difficult to go on a full campaign and expect patients to use it just like that. And I think it's better if it's coming from clinicians and implementing partners. And that's why we're trying as much as possible to engage with stakeholders, implementing partners. Just like any health app, people are already always reluctant. You don't know how your data is used, you don't know how your data is processed, and people are reluctant. But that's why we're engaging stakeholders more than just doing a TV campaign or radio advert. We've been to some of stakeholders meeting in Nigeria. But one thing you should also know is that with innovations like this, and there's always some kind of reluctance to change. We just need to keep engaging. And we've spoken to DG NACA late last year, and we are trying to also continue to engage with him. We've attended conferences in Nigeria. In fact, we attended another one in June the African Digital Health Conference in Lagos, where we'll be also having a booth, showcasing this. So we are doing what we should do, also minding the peculiarity of this disease, and that's why we're engaging. And we're also open for you guys to link us with other people, that you think we should be talking to. That would be appreciated. Thanks.
Thank you for that, Maureen. I mean, this is the core features in the app is really the ability to connect with your healthcare professional, and the ability to connect with the buddy system. And without these two features, it's not impossible. It becomes very difficult for patients to be able to have their condition monitored. And the best person who could encourage patients to use the app, as Shola just mentioned, is the healthcare professional themselves. And that's why our strategy is to work with implementing partners and HIV services so that they can encourage patients. And we've seen time and time again, if a doctor or a healthcare nurse or a community support worker recommends something, a tool, patients do comply. That's how it is. And it's working very well so far. And so that's the way, that's the kind of the strategy that we have in place. So we've got a question from Borbala. Do you want to come in?
Yes, I do. It's not really a question. It's more like a suggestion, because you asked if we could give like possible things that we feel like, partners that we feel like could help. So this is not like a clinical partner or someone that's in that field, but I do know that one of the biggest, most influential places in Nigeria, like that people get information from, is Human Rights Radio. And I feel like this is something that definitely, because it's, from what I'm hearing, it's definitely a great innovation. And this is something that they would definitely love to put out there to help people, because a lot of Nigerians listen to this. And also, I guess that can also be an avenue to help Nigerians, remove Nigerians from that stigma of HIV, that mindset of stigma. So I was just suggesting that could be a possible way to also get the information out there, to apart from the clinical, from the clinical side.
Sorry, which organization did you mention?
The Human Rights Radio.
Okay.
Yeah, Human Rights Radio, because it's not just Nigerians here that follow them. We also have Nigerians in Nigerians abroad. So it's a really broad place, like a really, really broad. So they tackle different issues, mostly based on human rights, but also they also tackle issues that are based on things like stigma. And also, if you come into a place like that, especially also if you're sensitizing Nigerians on the effect of stigma and also putting out information like this, you would definitely have a wide reach, because people listen to this every single day.
Okay, thanks for that. Thank you very much
for that. Yeah,
No problem.
thank you. I mean, we're working very closely with a lot of advocacy groups, a lot of NGOs in Nigeria. I think it would be nice to have this in the mix with the Human Rights Radio. Thank you very much for that, Borbala. Great. Any other questions? Any other suggestions? That, I mean, we'll be more than happy. You know, it'd be great if you can at least share this with your network and colleagues, especially if you know any services or implementing partners that we could potentially kind of get together with. Please do share this. Okay, if there isn't anything else, well, thank you very much for joining in and sparing this hour. I think it's been a nice discussion. We're very much delighted for you to have at least had the time to join in and share your thoughts with us. What I will do is we'll try and share this recorded session, okay? And hopefully let's keep in touch and continue with the discussion. So thank you very much for joining in.
Thank you, everyone.
Thank you. Take care of yourselves.
Thank you very much.
Have a lovely weekend.